Post-Caesarean hematoma seen in a 28-year-old operator whose deliveries were by Caesarean section. The last Caesarean section was an emergency due to breech presentation. So she presented as the 6-week postnatal visit with complaints of altered vaginal bleeding and abdominal swelling. So this actually is a case of secondary postpartum hemorrhage. On examination, the abdominal mass corresponded to about 18-20 weeks and it was not tender. However, she developed fever 24 hours prior to presentation, but otherwise clinically stable. Please remember that ultrasound is the investigation of choice for both diagnosis and follow-up of post-Caesarean section hematoma. So now let's look at the different sites of post-Caesarean section hematoma and see where this case fits in. Rectus sheath or subcutaneous hematoma, only due to injury to the inferior epigastric vessels. Bladder flap is between the lower uterine segments, the bladder, subfascial, as the name suggests, and the broad ligaments usually pushes the uterus to the contralateral side, and if it's large, there may be blood pressure on the kidneys, and uterine scar or incisional hematoma. So let's look at this video and see where this case fits in. The bladder, vagina, cervix, the hematoma. So, cervix, the fundus, the region of the scar here, the hematoma here, not this area of defect here, in the lower uterine segments. Again, fundus, region of the scar here, and look at this track somewhere here. Look at this track here from the uterus into this heterogeneous lesion, which is consistent with hematoma. US patient presented with a fever 24 hours earlier. The large hematoma could give that, but of course if the hematoma is infected, also give fever. But hematoma is avascular, while abscess will take up color. So look at the track here from the incision site into this huge mass. So is this the rectus sheath? No, because you can see the intra-abdominal wall here. These are fluids in the bowel. Is it bladder flap? No. Is it broad ligament? No. So what is it likely to be? Uterine scar, hematoma. So here, look at this lesion. It's avascular. Presence of an avascular heterogeneous mass near the uterine incision with or without fever or pain strongly suggests post-Caesarean section hematoma. And here you can see the measurement of the defect, about 1.2 centimeters. Look at the volume, 461. So it's a huge hematoma. Again, fundus of the uterus, region of the scar. Look at the track. Same thing here, and the track. So this was a case we managed some times back, and it's also in one of my videos on my YouTube channel. You can see the uterus here, and this broad ligament hematoma, and at the bottom you can see this broad ligament hematoma, just push the uterus to one side, and if there was evidence of back pressure, this is the index case. So let's compare the cases. So you can see this front ligament hematoma and the uterine scar hematoma. This patient was expected to come up for follow-up, but we are yet to see the patient. So thank you very much for listening.